exciting edition of American Warrior Radio, the place to be for news, notes, interviews, and current events for all issues military and veteran related. If you or someone you know has ever worn the uniform of the U.S. Army, Navy, Air Force, Marines, Coast Guard, or National Guard or Reserves, you've come to the right place. American Warrior Radio, right here on the Talk to Me station, AM 1300 WMEL, sponsored by MyHealthEVet Project. This program is all about supporting our troops. So all you patriotic Americans out there, get comfortable and let's kick the tires and light the fires. My name is Garen Cohn. I'm an Air Force veteran and a retired legal advocate for veterans and founder of MyHealthEVet Project. And I'm happy to be here today with my co-host as usual.
Good morning, Glenn McGuffey. I'm your Brevard County Manager of Veteran Services Team. Got that all backwards. That's all right. We've got a great show for you today. We've got Dr. Ken Vehec with us again to talk about electronic benefits portals with the VA, what's available now, what's coming. Very exciting. I want to tell you that I was listening to the introduction, and you know, sometimes that just goes by you because we do this every week, but I noticed that you know, we've limited ourselves down to just the 4 branches in the Coast Guard, and I think in the future program we'll come on with the other 35 agencies that might qualify for to be veterans. It's amazing. So
okay, I get the point. We'll include them also.
All right. Well, I don't think we need it in the intro, but we have a program about it.
The idea is there are benefits, and unless you listen to American Warrior Radio right here on WMEL and get engaged with your local providers like Glenn at the County Veteran Service Office, you may not know what's available to you. You mentioned we have a special guest. Back with us again is Dr. Ken Vehec. Hello, Ken.
Good morning, everybody. How are you today?
Doing great. So glad to have you back. It was several months ago, I think, that we had you on and we discussed some of the, as Glenn was saying, VA portals where folks can access information and benefits through the computer. But before we get into all the details and maybe some new happenings, and particularly the e-benefits, can you tell our audience a little bit about your background?
All right. Just a quick refresher. Navy veteran, disabled vet. I was involved in a missile explosion, and as a result I had to do a lot of retraining through the VOC rehab program, and that's available to any veteran that is above 20% disabled. They were able to pay for all my schooling that enabled me to move forward, and then I decided that what I really wanted to do was to give back, so I became a counselor at the Orlando Vet Center, which is the readjustment counseling service that's available not only to the veterans, but it's the only part of the VA that is allowed to provide benefits to the families as well. All right, so keep that in mind. And then this project came available about a year ago to where I could enroll or help over 90,000 veterans in Central Florida get engaged electronically, and also bringing into the modern age the VA through the computer access to records through the MyHealthEVet program. So it was an opportunity that I jumped on. I was given 2 years to accomplish the full implementation of this program, and we accomplished it as of October 1st.
Hallelujah. Good work. Good
Thank
work.
you.
I personally participated in it, and it is pretty streamlined. It's kind of a neat way to deal with the VA on a different level. And I know this is going to be a benefit to you in your office, Glenn.
Oh, absolutely. It's gonna allow our clients greater freedom to get the information they need to accomplish the claims work in the proper and right manner, so that we maximize their opportunity to get the benefits they've earned through service to our country. You know, I noticed one of the things coming in here is you can get to download a copy of your 214, which you can do online now, but it takes about 3 weeks to see the 214. So, you know,
yeah, there's a lot of benefits, even checking status of claims.
Oh, absolutely.
Which we'll get to in a minute regarding the e-benefits side of it all. But specifically the MyHealthEVet, can you give the audience a little refresher on what that is exactly?
MyHealthEVet is the VA's transition into the electronic era through the computer. It provides any veteran who is being treated at a VA facility anywhere to have access to their records, to be able to reorder prescriptions. They get a copy of their lab work 7 days after it's drawn. They'll be able to download the raw data of their labs. Not the doctor's interpretation, but the actual raw data of what the labs say.
So if they were following their glucose, their sugar level or something, they could get that kind of immediate access
In
to the
7
results.
days, they'd be able to have access to their A1C. Yes. And there are a lot of people who track this, which the MyHealthEVet provides for that as well. You can go in there and set your own trackers, your markers, whatever information you want to receive about yourself, and then you can also follow along. Say if you're seeing an outside specialist, you can put those notes and upload those into that personal health record. The nice thing about this is it's not just for veterans. Your family can do this. Now, Google Health just went away. We're really the only electronic form of medical records that's out there, and that's through the VA, which is kind of impressive.
So through MyHealthEVet, you can research medical issues?
You can research, it's vetted information, which vetted is not like going to Wikipedia where you can, find some information that is 90 to 95% correct. This has all been run through the mill. It's been peer reviewed. This is like going to a regular research site. The information you're going to get is as up to date and as correct and true as possible up to that moment.
Sounds impressive. Can you give us an idea of what's involved in participating in this program? Because a lot of folks are going to steer away from the computer, or maybe they have that privacy issue that they're concerned about.
Yes, the privacy issue was huge for us. It was our number one concern. This system is so firewalled and so protected that, just to let you know, when you access the system, it's not accessing through your computer. You're actually accessing a separate government portal that stores the information. So when the doctors put the notes in, and then when the emails go back and forth, they go to a server and they stay on the server. You're actually just retrieving the information from that server. So it never actually makes it to your computer until you download it to your computer. And that's the way, one of the ways the VA keeps it nice and secure. Now, you would think with all that security that's in place that it's a difficult process. It is not. It takes about 10 minutes to register for MyHealthEVet. You go online to MyHealth.va.gov.
MyHealth.va.gov.
Click to register. A one-page profile pops up where you have to put in your demographic information. You put in what information you'd like to see come to you through your email, and that can be anything from diabetes to high blood pressure to PTSD, depression, anxiety, overeating, anything like that. There's some blocks on there. And then what we found to be one of the most difficult things is where people put their username and their password in. Now, the password has to be 8 characters long. It has to contain letters, numbers, and a special character.
Again, for the sake of privacy.
For privacy, you want to make it a nice, strong password.
And for the folks out there, you want to write these things down and keep them in a private, secret place.
Well, and anyone that comes to see me, on the back of my card, I have the website and also the username and password, which they can write on there after they've created it. Either stick it in their wallet or put it by their computer someplace safe and secure where they will know where it's at just in case.
Yeah, excellent idea, because I got so many passwords and usernames myself for so many systems that I've got to have it put down somewhere where I can access it, and I know, just like you said, that will be a big issue for the users, especially for and nothing against elders. I'm an elder myself now, but some of our older veterans are not up to using computers very much, so that I can foresee that our office might be able to do a little training to help them get in and fully utilize this to their benefit.
Well, that's one of the things that I do. If you want me to come over one day and spend a day in your office and train your staff and anyone that comes through the door, help them get registered, I'd be more than happy to do that.
We'll take you up on it.
Yeah. And also to keep on the privacy issue for just a little bit longer. For those of you that are worried about the employee side of the VA having access to your records, it takes 3 different levels of passwords for me to be able to access anyone's health record. So not everyone has that level of access. I have that because I'm a provider at the VA. So anyone else that's just a regular employee is not going to have access to it. People in different areas, it's like in the military. Your top secret clearance, your secret clearance, it's still based on a need to know. And access to this is tracked. So anytime I open up somebody's record or another provider opens up somebody's record, it's been marked that that individual opened up that record. So the security is there. It's in place.
There's no arbitrary access going on. Nobody's going to be able to look at somebody else or a patient's record without having a need to know, like you said.
Exactly. And also, one of the things that I talked about last time we were here was one of the biggest fears from the provider side was that they were going to be inundated with all this information of, hey doc, look at my pictures from my vacation, or hey, I got this Nigerian prince that needs help, please help me send him some money so we can get him out of his jam. None of that is occurring. As I said, this system was going to be used properly by the people that are using it. The messages that we're seeing is the proper message traffic. It's about their health care. You give a veteran or anyone the input and the ability to have this control over their own health account, and they're going to become more proactive, and they're going to do it properly. So all the fears have been alleviated that this is just going to explode and be a big problem. It's not. Everyone out there is doing exactly what they're supposed to with the system.
And you mentioned some of the highlights. So it's that easy to get registered. Go to MyHealth.va.gov, click on register, go follow the prompts.
Follow the prompts.
Let's say somebody's in the middle of this and they have a problem, what can they do then?
Well, then there are different areas. If they get stuck, they can go to one of their clinics, the 7 that we have located throughout Central Florida, and find either one of the clerks at their primary care team or at the Release of Information office. They'll be able to help them register for this program.
Okay, so that's the first level. You get registered, and then I'm going to have access to my prescriptions, maybe doctor's notes, and secure messaging at that level?
You'll have access to your prescriptions at that level.
Okay. So I'd be able to track when a refill is due. Would I be able to order my refills?
You'll be able to order them at that point. Yes.
Interesting.
Yeah. Now, there's a second level, which is called the premium level, which you have to be in-person authenticated. And that's also on the site, that after you've registered for your account and you get the little blurb that pops up that says, congratulations, you have successfully registered for a MyHealthEVet account. You'll get another area that'll ask you if you want to opt in for secure messaging. Now, secure messaging, that's where you have to get behind another firewall to be able to send a secure message through email to your primary care team. Now, this will go to your provider, the nurse for your provider, and then also it'll go to the clerks if you need an address change, or the pharmacist if the pharmacist can do the reordering. No matter what, it just goes to your team. But you have to have this in-person authentication done. But the form comes up, it's fillable, it's a PDF. You type in your information, you print it out, and you take that to either your primary care team. One of the clerks out front can initial it and authenticate you, or you can take it to the Release of Information office and they'll be able to authenticate you. And then after the computer updates, which takes about 24 hours, you'll have full access and be fully authenticated within the entire VA system.
It's an impressive approach to trying, like you said, give some control to the patient. And you mentioned the secure messaging. So once I'm at that level, I've been in-person authenticated by my clerk at the desk that you check in at when you see the doctor, or some other areas. You mentioned Release of Information has the ability to help people get authenticated, right?
Correct.
At the outpatient clinics. And I see my doctor, and maybe I forgot to mention that I needed a lab done or a test or an x-ray or something. I could get on this computer program on MyHealthEVet and use a secure messaging system to send the doc or the team, as you mentioned, a note saying, I forgot about this. That's actually
the way it's designed to work. And the nice thing about that is that you're not calling in to talk to telephone triage, which those of us who have dealt with telephone triage, myself as a disabled vet, before MyHealthEVet came along, it's a bit of a wait at times, up to 45 minutes to an hour. With this, you type a message, you send an email, and you go about your business. The doctor has, and the team has 72 hours to respond to your message, because this is for non-urgent, non-emergent, and I should stress that as well. So that something like, oh, I needed a test, or I need a refill or a renewal on my meds, that's something that you don't have to wait on the phone for. You can just send the message, go about your business, come back, and you'll have a message waiting for you. Well, and you check it, and the doctor will say, okay, I've either ordered this test, here's your appointment, the medications have been renewed, you should expect it within 5 to 7 days, whatever.
It's an impressive system, and I've personally gone, I'm a member, I'm at the premium level, and I'm also engaged in the Ebenefits, which, Doc, you helped me get all this straightened out. It's pretty fluid. It actually works pretty well once you get involved, once you get fully engaged. the thing that I'm curious about on that particular site, and I don't want to get the audience too confused, but there's an opportunity for you to put your own notes and journals and medical stuff. Who's going to be able to view that? Just me or anybody that can access my site?
It's just you for right now. Eventually, when all the systems become activated and fully implemented, then you'll be able to give access to your site to your provider. Or, for right now, what you can do is via the blue button, download that onto a little thumb drive and carry that with you. So no matter where you go, if you're going to be traveling all over the United States or something like that on a vacation, you want to take that with you, put a thumb drive in your computer, download your information, carry it with you. No matter where you go, pop it in, go to a Staples and print it out.
Now, speaking of that, would not your information, if you're using the VA as your primary care provider, be available anywhere in the United States without having the thumb drive with you? I realize the thumb drive would provide the other private provider notes and stuff that you put in there, but it's my understanding that the other healthcare information would be available. If I go to Montana and go to wherever it is, Fort Harrison, I think, or something like that, and go to the VA hospital there, wouldn't they be able to pull up my stuff?
They're not able to pull it up directly because each VA does not talk to each VA system. The systems are not linked that well yet. However, what the provider or the attending physicians or team would do is they would send a message to, like, say you're in Montana, you're in Billings, or you're in Bozeman or wherever, and they go ahead and request your information from the Orlando, Central Florida VA. Well, it takes a few hours for that information to get pulled and then sent securely back over to Montana. So you're going to have a time lag. So it's better to have the thumb drive.
Okay, well, that's a good point.
And this is the difference between the VISNs,
Right, and the age of the systems. Some of the
Okay.
systems have been in place for a long time, some haven't.
Is there, even with the MyHealthEVet, because it seems this would encompass, I mean, you could be in Germany and access MyHealthEVet.
Yes.
As long as you have internet access.
Correct.
So there isn't any way that the provider in Glenn's scenario there in Montana could access an individual patient's MyHealthEVet. That's just for the patient.
That is just for the patient.
And then,
again, that's the security of it.
yeah.
Security is job one for us, I guess.
Yeah, so some great information for you folks out there, especially about the being able to access your information, because you may have an emergent condition when you're using my Montana example out in Montana, and several hours is not going to really hack the program. I mean, they may be able to get it by telephonically in an emergent condition, I would think, but having it on that thumb drive, they just plug that puppy in, and the information's right there they need to provide the treatment you need right then. So that's a great idea. Write it down, put it in the forefront of your brain, whatever you got to do to remember that.
But also, it would seem, if I'm in Palo Alto at the VA and they don't have a record of my prescriptions because the VISNs are not fully integrated like they should be or hopefully will be, I could go to my laptop and pull up all my meds that I'm currently on, because it provides history too, not just which ones are active, but all your medications.
And for those who don't have laptops, they can go to the Release of Information office, access the MyHealthEVet website, and print the information out right there through the VA.
Because you have kiosks in these places for that purpose.
Correct.
Are there any in Viera?
There were 2, now there are 3. And they're at the Release of Information office, and also in the conference room, which is D211, which is where the new patient orientation takes place. And they have their own printers that are dedicated directly for those computers, so anything that you print out comes right there.
Folks, if you have a question, dial us up, 321-631-1300, 631-1300.
Yeah, and I'm thinking about it as we're going through here for the folks, in an interesting conversation that we're having. Is there any concern? I know my workload is going up at the office as people have picked up on my internet site and my email address, and it's increased the amount of email traffic, which has increased my workload. Is there any concern about overdoing the workload for already very busy healthcare teams?
Well, Glenn, that's an excellent question, and it was one of the points that I was trying to stress the last time I was here, where this program actually decreases the workload for the providers and for the teams. And let me explain why from a provider standpoint. At the end of the day, we have to take care of the view alerts that come in, and those are the phone messages that come in, those are the things that come in through telephone triage, and each provider has to take care of those at the end of the day. Now, if I wanted to use a phone to contact the veterans, what happens? Say I call you and say, hey Glenn, I'm returning your phone call based on your request for this renewal of whatever. And you say, yes, yeah, that's what I called for. But you know, Doc, while I have you on the line, inevitably that's what happens.
You bet.
Now, what we're seeing here with the MyHealthEVet is that the doctor or the provider or the nurse, whoever it is, can just send the email message back and you're done. Nice and simple.
And I do agree with that part of it. It is easier for me to answer an email than it is a phone conversation, because invariably you get caught up in some other issues with phone conversations. Not all of them, but a lot of them.
Sure. Folks, stay with us on American Warrior Radio. We're at the bottom of the hour for a break. We'll be right back with Dr. Ken Vehec from MyHealthEVet. Stay tuned. Okay.